Testing, testing, 1, 2, 1, 2, 1, 2, testing. Yep. Have you white balanced? Need a white balance? Oh. Truman, we good? Okay.
Yeah, Travis, then Steve, then Jordan.
So Stephen is after Travis.
It's just to close.
Welcome. Thank you for coming here today to celebrate this landmark announcement. I'd like to thank Halifax Health for hosting today's event, as well as the Volusia County Community Information Team for the audiovisual support. My name is Steve Civitelli. I'm the health officer for Volusia County, Florida Health Department. Recently, in developing Volusia County's Community Health Improvement Plan, substance abuse and behavioral health issues, specifically overdose prevention, rose to the top in terms of community priorities. In Volusia County in 2021, there were 2,447 suspected overdoses, with 407 deaths related to substance abuse. Coordinated Opioid Recovery Program, also known as CORE, addresses these concerns by creating a network of addiction care. This comprehensive approach expands overdose response in the community by having peer navigators in the emergency department while also addressing the medical and mental health needs patients require post-overdose. I would like to acknowledge our community partners that are present here today in the critical response in our community. Halifax Health, Daytona Beach Fire Department, SMA, the Sheriff's Office, the County Council, County Manager's Office, and the Mayor of Daytona Beach. Today we are honored to have our State Surgeon General with us. Dr. Joseph Ladapo was appointed as the Florida Surgeon General in September of 2021. In addition, Dr. Ladapo also serves as a professor of medicine at the University of Florida, where his research examines behavioral economic strategies to reduce cardiovascular risk in low-income and disadvantaged populations. Dr. Ladapo is dedicated to ensuring Floridians are all afforded opportunities to maintain their health and wellness. Thank you for being with us today, Dr. Ladapo, for today's announcement and an issue that is very critical to our community.
Good morning, everyone. I'm just still taking in that code call that just went overhead, and it took me back. And God, hopefully it's nothing serious for the patient who it was called for. But it brings up feelings and brings me back to working in the hospital. Well, we're here for. I'm really happy to be introduced by Steve because we interviewed him many months ago, and we brought him here from Connecticut. And the people, he's our health officer here, and the people in the office love him. I mean, they had nothing but great things to say about him when we came to visit a few weeks ago to see how they were recovering from the hurricane. And, and everyone would just grab me and say, "Oh, he's doing such a great job. We're really happy he's here." So thank you for leading the health department here. And we're talking about something that is really important and really exciting today. As Steve mentioned, it's our coordinated opioid recovery network. And what's exciting about this is that it is one piece of the puzzle, the solution to addressing what's just a major problem right now in the country and in this state of Florida. And unfortunately, something that's affecting just many people, either directly or indirectly. And that, of course, is this opioid crisis that we're having, and this crisis of addiction that we're facing in Florida and around the country. So Stephen mentioned some numbers. It's definitely a problem here in Volusia County. In the state of Florida last year, 8,000 people sadly lost their lives from a drug overdose, and 70% of those drug overdoses were related to opioids. And of course, the new item that has just really exploded on the block is fentanyl. And the depth of tragedy that fentanyl is creating, particularly for people who weren't even using an opioid. They were using something else, and obviously we don't want people using anything because none of that stuff is good for you. It's all harmful for you. But just the degree of pain that it has caused family members of people who've lost their lives. I mean, there's no depth. There's no depth to that pain. And it's increased by somewhere around 800% or so in the last few years. So it's been explosive, and it's been deadly. And then I mentioned the hurricane. So we think about the hurricane during times of when we're concerned about potentially things like depression and mental strain and stress, making whatever people's situations already are worse. And we've seen some of that. We see it every time after a disaster, that it can have really an impact on a lot of people, on people's mental and emotional and spiritual well-being. So that adds to the impact, that adds to the importance of addressing opioids and drug use and drug abuse. And we know Volusia was affected, and we got to see a little bit of that firsthand when we came down to visit a few weeks ago. So in response to this, fortunately, and it's such a complicated problem, but in response to this, one thing that Florida is doing that, to the best of my knowledge, no other state is doing, is that we've launched this coordinated opioid recovery network. So it was launched by the governor, Governor DeSantis, and get out there and vote, please. It was launched by Governor DeSantis a few months ago, and what the program does is it's a coordinated program that applies evidence-based methods to people who have overdosed or have a problem with opioid addiction or other drug addiction and are looking for help. And it does so in a really common sense way, which of course has been an element of health policy led by the governor and supported by me also, that we've seen for the last few years in this state in contrast to many other states in the country. And its common sense element is that it realizes that people who are dealing with addiction, it's not like abdominal pain or a toothache where you can give us an individual instructions and have them follow up and call and make the appointment and show up at the doctor's office. I mean, this is a condition that it literally erodes a person's emotional, spiritual, mental well-being, and it also harms them physically. So this coordinated opioid recovery network program brings the services to the point of care. It brings the major players, our first responders, our counselors, our psychiatrists who have expertise with prescribing things like buprenorphine and other evidence-based medications, our peer counselors and peer supporters, to literally the bedside of the patient to make that handoff warm and to make sure that they are, at the time that they are looking for help, getting as much support as they can receive. So they're not just going away and then facing stressors and other challenges that people face when they're back in regular life and can potentially slide back into the habits that are harming their lives. So this program is being launched. It was launched in Palm Beach County, and it's been very successful there. It was really a chief architect of the program has been Dr. Shepke. He's just been a wonderful contribution to the design and implementation of this program, both in Palm Beach County and in the 12 counties that we're currently launching it in. And I'm very excited about it because I do feel that it's extremely highly likely to be effective. And that's something that has been missing, really effective programs for this problem. So I'm very excited about it. We're doing it with our partners. We're doing it with the Department of Children and Families. We're doing it with the Agency for Healthcare Administration. And I'm looking forward to seeing how outcomes evolve and seeing patients who are helped by this. So we're all looking forward to that. So next, I would like to introduce Erica Floyd Thomas, who is an Assistant Secretary at the Department of Children and Families.
Good morning. Thank you so much for hosting us. It's an honor to be here today, specifically as we launch the coordinated opioid response in Volusia. The department contracts with managing entities and they control our network. And I'd like to say a special thanks to LSF who's here today. And because of them, we have a tremendous role of partners here who help with the recovery effort. We have EPIC, Children's Home Society, Flagler, and of course Halifax. We also have the Gulf Coast Jewish Community Center, Outreach, and Next Door. So thank you guys for that. As mentioned by Surgeon General Latipo, The DeSantis administration has been characterized by just unparalleled cross-agency collaboration. We've been eliminating historical silos. We are placing focus squarely on the best interests of Florida's families. We are immensely grateful for Governor DeSantis and his championing of this initiative. It's a first of its kind. And we definitely are grateful and thankful to the Department of Health leaders, Dr. Latipo, Dr. Shepke. Without you, we could not move forward with this. This, combined with the First Lady DeSantis' commitment to reducing stigma, has been essential as we move forward in the fight against opioids. We are grateful that we have this opportunity as a state opioid authority at the department. We really take this responsibility seriously. We want to make sure that we have high-quality, evidence-based services. And in doing so, the partnership with CORE gets us to the place where we like to be. In Volusia County alone, DCF has a whole host of network providers who have done the following. We have 18 naloxone distributors who provided more than 16,000 naloxone kits to communities since 2001. This led to more than 1,400 reversals, offering individuals a second chance at life, which is truly important. That's a second chance at life. 2 recovery homes through our Oxford House of Florida. It has the capacity to serve 21 individuals, including children and families. We also are appreciative of our special partnership that we have with Volusia Recovery Alliance, who touched the lives of more than 300,000 Volusia residents since its formation. We also have our Hospital Bridge program here with Halifax and Advent Help. They use peers to promote recovery, entering into recovery, meeting individuals where they are, and helping them go into that lifelong journey. Since Governor DeSantis has taken office, we have spent $1.4 billion that we've invested into detoxification, treatment, and recovery. And this recovery and treatment is for adults and youth, so we're very proud of that. Last fiscal year alone, we were able to provide substance abuse disorder services to more than 60,000 children and youth. So addiction is a disease like no other. This is something that takes a hold of you physically. It causes you to abandon your dreams, your family, your aspirations. It is a challenge. And so the hopes that you once held have faded away. So this is not episodic, it's not acute. So we know that this is going to take a lifelong journey, and we want to be a part of that journey to get you to where you would like to be. Our goal is to optimize every single moment of impact, and with CORE, we're able to do that. Those moments of impact to be able to provide support, induction, medication-assisted treatment, care coordination, and a peer to be able to do that. So many of you know that DCF is the agency that protects children from abuse and neglect. We have 50% of our calls are about substance abuse disorder. So those calls come in from family members concerned about individuals who have a substance use disorder. So if we recognize that, that means that we would be removing children from their families. Our primary goal is to support families so they can be healthy, happy, and strong. And in doing that, we would like to be able to support those families by helping them to get into care. So these evidence-based services do just that. We can help families stay intact, and we can build stronger communities. One of the greatest redemption stories that we have is when a parent is able to overcome their battle with substance use disorder, and they're able to enter into recovery to be the person they want to be and the parent their child deserves. We are proud of the resources that we put forward. We're proud to be a part of this initiative, and we can't be more thankful for the Department of Health of spearheading this. So thank you ever so much, and I'm going to turn this over to Dr. Shepke.
Thank you. Good morning. I'm excited to be here to help with the rollout of the CORE network here in this county. This is something that's really needed, not just across our state, but really across the nation. And I appreciate the Surgeon General's leadership, and thank you, Assistant Secretary, and certainly the leadership of Governor DeSantis and First Lady DeSantis in making this a priority. My specialty is emergency medicine and the subspecialty of EMS. And the reason why I bring that up is because we as a society made a priority a number of years ago. Back in the 1960s, we had an epidemic of deaths on the highway. And we got together and said, you know, we really need to do something about this, and we developed the 911 and trauma system. And you'll notice that in the 911 trauma system, if you were to have a severe crash or get injured in some way, we don't just take you to any old hospital. We don't just have any old protocols. EMS has specialty training, specialty equipment, specialty medications we use. We bring you to the facility where inside there are multiple specialists that specialize in that particular disease, and once stabilized, We don't tell you, hey, go follow up somewhere. We bring you into a long-term recovery program where you can get rehab to get good long-term healthy outcomes. That is a coordinated system of care. And we have copied that coordinated system of care several times in the House of Medicine. And every single time we've done that, we've seen a drop in the death rate and the drop in the morbidity rate. Certainly we've done it for trauma, we've done it for heart attacks, we've done it for stroke, and now we're going to do it for substance use disorder. Now let me explain why this is important. In the last several years, overdose deaths have surpassed car crash deaths. So back when we came out as a society and said we got to do something about this epidemic of car crash deaths, we are now at an epidemic of overdose deaths. So we're at an inflection point where we really need to get serious about treating this disease. And notice we're all talking about this as a disease because that's what it is. With advanced neuroimaging, you can see the changes in the brain from this disease. It's not a choice somebody has. They can't choose to not have this disease any more than someone with diabetes or high blood pressure can choose not to have those diseases. It is a lifelong, chronic, relapsing, life-threatening disease. And can you think of any other disease that meets that description where we expect the patient to take nothing? I can't. And that's where evidence-based medications come in. Things like buprenorphine, like the Surgeon General mentioned, and there are others. So thank you to Governor DeSantis and First Lady DeSantis for recognizing the need for this statewide system of care, this coordinated system of care, where patients now, well, let me talk about what the current system is. Because in emergency medicine and my EMS colleagues, we see this all the time. Somebody overdoses on the street. 911 is called. EMS arrives. We give them some sort of reversal agent. We're brought to the closest emergency department. Once the patient is stabilized, they're given a list of services to follow up in the neighborhood, and basically the patient is discharged to overdose again, and the cycle repeats. That revolving door of overdose is a failed model. And that's why it's so important that we have this model now, because this particular disease, you can't expect somebody to navigate a very complex medical system with all the various silos to get what they need. And CORE is a really important program, but I don't want you to think that this is a simple fix. This is a difficult disease. It's a multifaceted disease. 80% of the people with substance use disorder also have mental health problems. Many of them have housing insecurity. Many of them have food insecurity. Many of them have infectious diseases like HIV or hepatitis C. They may have dental problems. We need to be able to coordinate the patient through a system of care that requires multiple different specialties and specialized protocols to treat the patient in a holistic manner. And that's where the Coordinated Opioid Recovery Network comes through. Now, I do want to be clear, you do not need to overdose to enter this system. You just need to have the disease and want to achieve the help. And then we will bring you into and we will navigate you through this system until you get good long-term recovery. Now, this has been a blight on our society in multiple different ways. And again, this is where leadership, like First Lady DeSantis' prevention program with the Facts Your Future is really helpful, because once you have this disease, you've got it for life. And the only way to not to have the disease is to prevent it. So the Facts Your Future program is giving the tools that our youth need in high schools and middle schools across our state on how to avoid this particular disease by never using this substance. And we know there are some genetic risk factors for this particular disease, but you don't know individually if you have those genetic risk factors. So really, arming our youth with those facts is really important so they can avoid developing this chronic illness. And then enforcement is an important problem. And thanks to Governor DeSantis, there are enhanced enforcement penalties for the people that are pushing these poisons on our society. And then long-term treatment, and that's where our Coordinated Opioid Recovery Network comes in. So I want to thank our partners who have come together, and I want to thank you all for being here. And I want to introduce one of our really important local partners here, Nicole Charbonneau, who is our Senior Vice President of Clinic Services at SMA Healthcare. Thank you very much.
Good morning. Thank you very much to Dr. Shepke, Dr. Latipo, and Erica Floyd-Thomas for visiting us today. And thank you to our partners at the Department of Health, Daytona Beach Fire, Daytona Beach Police, and Halifax. The opioid epidemic has forever changed the way that we provide substance use treatment in our community. And thankfully, in Volusia County, we have had really great partnerships addressing this effort for quite some time. However, With Volusia County being selected as a Phase 1 county for the CORE effort, it really demonstrates that there's a lot more work to be done. With CORE, it'll allow us to further enhance the coordination of the services as well as the availability of treatment for people living with an opioid use disorder. Through 24/7 access to emergency screening and detox, community-based overdose follow-up care, emergency department intervention, and outpatient medication-assisted treatment, there truly will be no wrong door for a person who is looking for treatment for their opioid use disorder. SMA Healthcare is honored to be a part of this CORE effort and also honored to be a partner with those of us who are walking alongside this effort. Together, we're not only changing the lives of the person who is living with opioid use disorder, but their family, their friends, and their loved ones. With that, I will turn it over to Travis Anderson, the community paramedic with the Daytona Beach Fire Department.
Thank you, Nicole. Good afternoon, everybody. In early 2021, the Daytona Beach Fire Department launched the first opioid overdose crisis pilot program here in Volusia County. It was known to many as DART, Drug Abuse Response Team. The goal of this team is to offer assistance to those individuals that just recently had an opioid-related overdose and required first responders, whether it be police officers, firefighters, EMTs, paramedics, but it required some kind of resuscitation. All of this was the intent to directly connect these individuals to available resources that are available here in Volusia County towards the addiction recovery and rehabilitation services. The team that we currently have consists of a Daytona Beach Fire Department community paramedicine officer, a Daytona Beach police officer, and SMA Healthcare substance abuse specialist and/or a peer from SMA. We also have spiritual support to help those upon any request. Twice a week currently, the team goes directly into the field to where the overdose occurred based on the first responders' responses or an address that is found on file to bring this information directly to that individual. The team is trained in this outreach, and each member plays a unique role as a valuable link in the chain. To date, since 2021, the team has made more than 500 total field visits in the city of Daytona Beach, and that includes some outreach opportunities also. And the team has also experienced firsthand individuals taking the first steps to recovery. When the team makes contact, believe it or not, they are welcomed by many. And after speaking with them, approximately almost 50% of those individuals ask for more assistance. Whether it be a nasal Narcan packet or requesting appointments or just more general information of what we have within our community. With this new CORE program, with the Department of Health and Governor DeSantis, this will help our program to reach a second phase. With this phase, we're developing partnerships with our local hospitals, such as Halifax, Florida Department of Health, and other community leaders. This will help us to expand those areas that we're just not able to reach. This will also help our team's availability more days through the week. Currently, we're 2 days a week. We're hoping to expand this throughout the entire week. And then we will also be allowed to, or we will allow for follow-up visits in which we can then see the process that they will be receiving. And then this should also increase accessibility to the MAT programs that are out there, the medication-aided assisted treatments. It's a great opportunity for Daytona Beach's DART team in coordination with CORE to really reach out to the community during this time of crisis that we're in. I thank you again, and we appreciate the opportunity. And with this, I will turn it over to Dr. Stephen Veal.
Thank you all. Dr. Shepke mentioned the history of treatment of overdose in the emergency department, and it historically had been exactly as he said, an over photocopied sheet of paper that had a list of some resources that people could call if they wanted to. It's been about 5 years since we decided that we could do better, and we formed our opioid overdose intervention program in partnership with SMA, and introduced peers into the emergency department and addressed this disease head on. This program is going to allow us to expand that program into the inpatient setting, to fund a nurse navigator that will help connect more patients to treatment within the health system. This will be successful for a couple reasons. The program recognizes that it needs to be coordinated. This is a problem that's too big for any one agency, one group of people, one discipline to address. It'll be successful because it uses evidence-based treatment of buprenorphine and uses the science to address addiction. And it will be successful because it addresses the human element. These patients are mothers, fathers, sisters, brothers, and they're people first. And the core program relies on peer specialists and people with lived experience to form that personal connection and bridge patients into treatment. And with that, I'd like to introduce Jordan Hawley with the Volusia Recovery Alliance and peer specialist.
Thank you. Hi, everybody. My name is Jordan Hawley, and I'm just going to say I'm nervous because I'm a person first. He was talking. I'm a mother, I'm a wife, I'm a daughter, I'm a friend, I'm a mentor. I'm also very blessed to work for the Volusia Recovery Alliance as a peer specialist supervisor and helping my staff be able to provide peer support to the community. Because I'm also a person that really needs these services in place about 7 years ago. Further than that, 10 years ago, I want to paint a picture, right? 10 years ago, I gave birth to my son, right? Handsome little guy, super happy. Everybody should be super, super happy because nothing was wrong, because I was too afraid to say that something was wrong. But I used during my pregnancy, and he was sick. And I was too afraid to tell everybody why he was sick. Until finally I voiced up and I said, I used while I was pregnant and he's substance exposed, which was the hardest decision I ever had to make because I had to take accountability for myself and these moral choices that I was making. But sitting in that hospital room, I realized it wasn't a moral choice I was making. How can a mother make that choice? I had a disease. I needed these services. I needed somebody to come sit at my bedside with me and tell me there was another way for me and my family. I needed to be able to accept treatment, medication for my disease that I had. That was unheard of. I've seen it be so successful. I've seen it save lives. Part of my job is to distribute Narcan to the community, and we get calls about those lives that have been saved. And I'm so, so grateful for every one of those calls that we get, because it's not just that one person that's been saved. It's the entire family. It's the kids that would have been left behind. It's the parents that would have lost their child. It's my friend. It's my sister. It's my brother. It's my cousin. It's a family disease that runs in the family. And I am so grateful to see all the community partners come together and work together to really put an end to overdose, to really put a change into families, to really see, I've heard everybody before me speak about how it's all-inclusive, to really see that all-inclusivity. And I'm really grateful for this opportunity to really bring the human part of this to it, because I'm so grateful for the partnerships and the community and all the fun, fancy words that my boss would love for me to say right now, I'm sure. But the people that care, the ones that want to know my name, right? That want to know why I'm here, that say that my story matters, because it does. Every one story touches so many other people. So thank you. And for that, I'll turn it to Steve. I'm supposed to point at him.
Thank you, Jordan. Thank you for telling us about your journey that brought you here with us today. At this point in time, I'd like to thank again Florida Department of Health's leadership, DCF, and our community partners in the efforts to make real change in our community. And that's essentially what this is about. So at this time, we will open it up for questions, and I'm going to call up Deputy Secretary for County Health Systems, Mark Lander, to answer.
And again, I'd like to reiterate what Steve and what this panel has said. Thank you all for being here, and I think you hear the words coordinated success, and I think that's what this program's really about. and you have the subject matter experts right behind you right now. So with that, I'd like to, is there any questions we have from our media that, or others that would like to ask this panel regarding Core Network? Oh, do I have questions?
Hi, my name is Victor Ortiz. I'm the policy chair for the Florida Maternal Mental Health Collaborative. I was just wondering if we'll reach a point where we can do case reviews on people that overdose when they don't make it, and try to forensically put together what happened, what systems they connected to, what kind of encounters they had, and what we could have done different to prevent that death.
All right, so hearing the question, would you like to take it? Sure. Dr. Shepke.
You just described exactly evidence-based medicine, which is basically a continuous quality improvement system where we do an intervention and we follow the patient as an outcome. And I think too often that science-based focus has not really been looking at this disease, where we're making interventions or doing certain treatments, not really studying the outcomes. And now we are. So yes, I mean, one of the pieces of the Core Network is actually data that we're going to be collecting from the 12 counties that we're rolling this out to, and seeing what works and what doesn't, and trying little tweaks to improve our success rates. So exactly what you're talking about is one of the things we need to do, and which we are doing now, is putting a medical science-based focus on this disease. Thank you.
Thank you, Dixie. Yes, sir.
My name is Ray Margaret. I'm a clinical pharmacist. I'm also the CEO of Clinical Life, which is a production CEO. This is directed to Dr. Latta. When are we going to have a non-specific patient standing order for Narcan so pharmacists can dispense it? Right now we have one just for EMS and police, but just non-specific. The law has been passed, allows us, but would you be willing to sign a standing order for pharmacists?
Any questions on that?
That's an important issue, and I think everyone is familiar now with Narcan. So it's a medication. Narcan's a trade name. Naloxone is the generic name, and it's a medication that's effective at helping people who overdose. Basically, block the effect of the opioid that has caused them to not breathe, and allows them to start breathing again. So it's saved many lives. Obviously, the real objective is to help people further upstream so that they're not overdosing, they're not dealing with addiction and struggling with addiction in the first place. But that's the question. And the naloxone access in general has been expanded in this state over the years. So, there are states where you don't even need a prescription. You can go to a pharmacist and request it. There's sometimes issues with the cost of the medication. So that's the perennial issue that all of us, anyone who's gone to a pharmacy and has had to purchase more than a few medications, eventually there's something that's not covered, or the price just seems out of proportion to what you might have expected. So this particular policy question, I'll have to get back to you. It's actually something that we've discussed, and I know that it's been an issue during Hurricane Ian. We did expand some pharmacy, I would say their privileges or their powers to facilitate more prescriptions when needed. But your particular question, we'll get your information and we'll get back to you with more details.
All right. Thank you for that question. Do we have any further questions? Yes, ma'am.
I'm a local OBGYN who does provide maintenance therapy and mental health therapy for women with addiction. And in February of 2020, Opioid had sent out an alert that buprenorphine could be dispensed with the x-ray of doctors to women who are pregnant and postpartum without the prior authorization, which was a huge positive step in the right direction. So we're very grateful. He said,
Well, I really appreciate hearing when there's barriers to care, because that's what we're doing. That's what we hear about, is to remove barriers to care for this deadly illness. So that's certainly something we're going to have to take a look into. The prevention of neonatal abstinence syndrome, which is when the pregnant mother is using opioids, is one of the goals of the CORE network. And first, I want to thank you for being one of the OB providers that actually takes care of that high-risk population. I know it's quite difficult, and I'm sorry to hear that your patients are having a barrier, and I'm certainly going to take a look into that specific condition once we get back to Tallahassee. Thank you.
Yeah, we'll get your information, and it's also an Agency for Healthcare Administration question because they administer the Medicaid program, but we'll get your information and we'll follow up with you.
Yes, sir.
I was going to say some of the pharmacists, I think we have had a specific order, but it has to be signed, yeah, the part of the physician to sign it. I don't think we actually have several physicians that are out. But if he signed it, then pharmacists don't have to, ask the doctor.
Yeah, sounds to me like we have enough information to move and follow up on that. So.
I do have a question, but I want to give a compliment. A lot of people are talking about is coordination of care, coordination between departments. And one of the biggest things that's happened lately is coordination between DCF and DOH to have Narcan supply. So I just want to say thank you for that. And I think all the work you're doing, it's been great to see that DCF.
I agree, and that's been huge for the health departments and that relationship with DCF. It's been fantastic. All right. Anything?
I have a question.
Yes, ma'am.
I know that in West Palm at JFK, they have that pilot program at the hospital. Are there any plans to do something similar at Halifax, or is there a specific ER for addiction to overdoses?
That's your question, Dr. Shepke.
Yeah, the program you're talking about is the one that the Surgeon General alluded to in Palm Beach County and has now expanded to a couple of hospitals, and was basically the model that we trialed for the Coordinated Opioid Recovery Network, where a patient isn't just brought to any old hospital, they're brought to one of two now emergency departments where the physicians and the nurses and the staff have been trained on this disease. We've got peer navigators in those locations. If the patient needs to be admitted, they get admitted. And at the end of that, they're literally walked over to their long-term clinic, long-term care clinic, where they've got multiple specialties of ongoing care. So that is the model that we are replicating. And each locality has a little bit different partners and a little bit different systems, but we are basically mimicking that here now in this county and in the other 12 that we're rolling this out to. Thank you.
Great, thank you. I can take one more question. Dixie?
Yeah, it's a very good, it's a great question in terms of highlighting the complexity of this issue. So the term harm reduction, I actually don't use that term personally because I'd rather talk about what exactly we're doing or what exactly the objective is versus a label or a rubric that other things are placed under. And that term, I've heard that term has been sometimes used for some of the things that have come up today. And fentanyl strips, maybe arguably, I hear less about that, but that might arguably fall under the same title. And what I would say, I think that it's a really important problem. Obviously, this addiction it's a profound problem, particularly when one considers the degree of pain, of turmoil that it can create for families and for loved ones that are left behind. For not to even speak of the poor individual who's overdosed and has died. But I think that the issues they're complex because it's how one approaches them really, it's not so simple. I mean, people have different perspectives on what the right approach is. My perspective isn't the same as everyone else's perspective. Individuals have different perspectives on it. So in fentanyl strips, I think, fall in that category where there's not consensus around whether that approach is the right approach. And even though sometimes something may appear to be the right approach, and maybe it is the right approach, but it also can take away attention and energy from other approaches to addressing a problem. So I think those are some things that should be considered when thinking about whether or not to adopt an intervention like that, dispensing fentanyl testing strips. So I think that's something that has to be considered. I don't think it's so simple as doing it or not doing it necessarily. And I could probably go on. I'm trying to decide whether I should share my own personal opinions about it. I'm not sure. But I hear you, and I think that it's complicated, and discussions are part of the process of approaching it.
Thank you, Dixie. And I think, really, you look behind us again, look at the title of what we're at, coordinated response, and that's what we're doing. And this is it looks at different mitigation measures, and this team behind you will be successful for Volusia County. With that said, please, let's give it up for this group behind me one more time for their efforts that they put in. I thank you all for coming today, and we stand behind Volusia County. So take care. Bye. All right, thank you all.
I'd like to get a group shot. Okay, let's have Dr. Ladapo.
We're gonna move this.
Oh, okay, we can get rid of that. All right.
Yeah, we're gonna move that out of the way.
Okay, everybody squish in. Let's see. Doctor, we need one more person on that.
Are you done with your picture? All right, thank you. Yeah, that's cool.
Okay. Right shoulder out. Yeah, that's good. Right shoulder.